Hello everyone, my name is Armel Junior Tokpo. I am from Benin. I am senior resident in neurosurgery department of Assam 2 Teaching Hospital. Here, I want to share with you an interesting case report. So, this is the case of a 30 years old man who had been admitted in emergency department after a motor vehicle accident for vertebral burst fracture along with a significant retropulsed fragment inside the vertebral canal were noticed. Surgery was decided. Post-operatively, the CT scan showed the correct placement of both screws in both pedicles of L3 vertebra, and that is what we are seeing on figure 2. 7 days after, we noticed a wound swelling. We admitted the patient in operating room, but intraoperatively, a significant uncontrolled paravertebral hemorrhage was encountered. But since we could not clearly identify the vessels, the source of the bleeding, we decided to achieve hemostasis with gauze packing and wound closure. Immediately after, a CT angiogram was conducted and revealed a left L3 lumbar artery pseudo-aneurysm, as you can see in figure 5. Selective embolization was conducted with success. It is reported that lumbar artery pseudo-aneurysms are quite rare. They could take place after severe trauma, and they could also be iatrogenic. 0.01% to 0.22% are related to spine surgery. This low prevalence contrasts with a high mortality rate as high as 15 to 65%. 26 cases were reported during spine surgery between 1991 and 2018, and various procedures involved. It could be a simple canal decompression, laminectomy, vertebral needle biopsy, percutaneous kyphoplasty or vertebroplasty, posterior lumbar interbody fusion, and also pedicle screws fixation with distraction maneuvers. In our case, for instance, there was no pre-existing pseudo-aneurysm before surgery, as the initial abdominal CT angiogram was normal. This pseudo-aneurysm is not linked with misplacement of pedicle screws. Our hypothesis is that of a stretching of a pre-existing fragile vessels during distraction maneuver, and doing so we could induce a breach in the muscular and elastic components of a pre-existing fragile arterial wall. The lesson here is, when possible, to rapidly obtain a CT scan in front of a delayed hemorrhage after surgical spine instrumentation in order to rule out vascular complication like a pseudo-aneurysm. I am at the end of my presentation. I sincerely want to Thanks all of you for listening to me.